scenario, we talked about John coming off his bike, and earlier on John was conscious without too much of an airway problem. Obviously, in principle, if we come across somebody and they've got a motorbike helmet on, there's always that issue of, well, do we remove the helmet? And when it comes down to managing John's airway, you can see that obviously there's no way that I can manage or establish an airway here, and if John is unconscious, there's no way that I'm going to be able to manage his condition. So my first principle that I need to do is actually I need to get this helmet off. And I'm going to need some help to do that. I can't do that on my own. Okay, so I need somebody to come down by the side and actually get hold of John's head and trying to immobilise it. So what I'd like you to do there is, first of all, if you could just have a go at getting that chin strap off for me. It's always a good plan, so we don't pull your head off while we're trying to get the helmet off. And then what I want you to do is I want you to bring one hand across the front of his neck, just to hold on to his chin. Okay, if you hang on to the helmet a second, I'm just going to demonstrate what I mean by that. Like that. Okay. And the other hand I want you to bring up and get as far underneath his head as you can, just to try and hang on to the back of his head. Yeah? So it's kind of wrapped around there. But then what I'm going to do is I'm going to... There's various structures that I need to get over, and the first one is the prominence at the back of his head, really. So what I need to do is I need to pull the helmet apart as much as I can, and your aim is to keep that head as still as possible so that I'm not going to move it. So I'm going to tip it backwards first of all. I need to get it over his chin, so I'm going to basically rotate and rock. It's quite a tight helmet, this one. Till I've got the helmet off, and then I can take control of that head. That's wonderful, thank you very much. Once I've got control of that head, and what I'm doing is I'm assessing John's airway to actually make sure he's using it. And normally in an unconscious patient, what we would do is a simple manoeuvre, a head tilt chin lift to establish an open airway, to get the tongue from the back of the throat to stop it causing any occlusion. In this case, I don't really want to do that because it's going to create a movement which may aggravate any injuries that John may have. So the alternative that I have to that is using something called the jaw thrust. So if I to bring my fingers round and just find the angle of his jaw and place a bit of pressure on there to bring his chin up, what I can do is I can establish an airway, but without compromising or jeopardising any spinal injury. So obviously the person at the head is going to have to maintain that jaw thrust at the same time as that spinal immobilisation, and then the rest of the assessment and immobilisation would be the same as it was before when we only demonstrated the movement onto the spinal board. But that's the basic principle of airway management in terms of spinal injuries.